All right, so when we're palpating the rest of the tibia and the femur, we're going to put them in 90 degrees because when you're at 90 degrees, you've actually exposed the femoral condyles. Ignore the difference between the model. The patella happens to be just fixed to the femur. In real life, that doesn't happen. As you can see, her patella is sitting right there. So ignore that difference. But let's do the femoral part. So in 90 degrees, we find the patella, and we're going to use that as our guide. We're going to roll right at the patella. You're going to feel the rounded contours of the condyle. So this would be the medial femoral condyle. Back to the patella. Slide off. You're going to find the rounded contours. That's the lateral femoral condyle. So we're in that area shaded in there. So again, almost like spools. You can see how they're kind of the spools. You can easily palpate them. They should be rounded and easy to palpate. Now, one particular landmark we want to get on the medial side is called the adductor tubercle. So what we're going to actually do is we're going to find it. You can see it's posterior in medial. There's a little bump right there. That's the adductor tubercle. So might be a little bit hard to find because we have so much muscle mass right here. We're going to find that medial femoral condyle. We're going to roll our finger posterior. And right about there, if you dig a little bit deep, you might feel just a little bit of an irritation. If the patient jumps, chances are you're on it because it's slightly irritated. Are we on it? She's not giving, I can't tell. She has a mask on, so she's not giving anything away. But that is adductor tubercle. So obviously our adductors coming from the medial side will be right there. So that's basically most of our femoral landmarks. Now, we're now going to move into the tibial landmarks. So again, here's our patella. We have our quadriceps tendon coming right down. And the first thing we're going to do is we're going to be able to actually put our thumbs right there. And we're right here. That's our tibial plateau. So actually I'm going to put a line right there. That's our medial tibial plateau. On the lateral side, you can actually see the indentation I'm making there. That's the lateral tibial plateau. And just inferior to them, you're going to feel these nice big bumps. Those are actually the condyles. So we have the medial tibial condyle, and we have the lateral tibial condyle. So that whole big area right there are the condyles, okay? So again, we have our plateaus. Now, our plateaus are a pogo. Palpate one, get one. So when you palpate, not only do you get the tibial plateau, but you also might get the anterior horns of the meniscus. So we have a lot of pogos in this class. So this might, I think this is our first pogo. So congratulations, our first pogo. Now, as we come down the condyles are actually going to taper to a point right here, and that's going to be the tibial tuberosity, a major landmark. So we can see our quadriceps tendon coming straight down there. So we're going to give ourselves a little tibial tuberosity. On some people, it may be more prominent because they are diseased with Osgood-Schlatters disease. So it's fine. It doesn't mean they're bad people. They're just special. But from here, we're going to use tibial tuberosity as a landmark, and we're going to roll our thumb just medial into this whole roughened area right there. That is Pes Anserine, which we're going to talk about. That's the Pes Anserine area, where we're going to have sartorius, gracilis, and semitendinosus all inserting in that area. We come back to the tibial tuberosity and we roll laterally into this roughed area. So we're over here in that rough area. That's going to be Gerdy's tubercle, where our iliotibial band is coming down on the lateral side and inserting right there. Now, that's basically our tibial landmarks. We can actually get to tibial tuberosity. We can follow the shaft of the tibia right down. You actually be able to feel the anterior border. It's very easy, very prominent to feel. Our last landmark is going to be the head of the fibula. Easy to find. We're going to start on tibial tuberosity. We're going to start at tibial tuberosity and just palpate all the way lateral, and you're going to notice a big bump on the lateral side. So as I start here, I just come straight across, and I'm going to feel there's a bump right in the middle of a muscle belly. It feels so weird. You're going to notice I'm inferior to the condyle of the tibia. So I'm inferior to the tibial condyle. That's crucial. And if we actually evert our ankle and invert, you'll feel the peroneal longus muscle starting to contract and get large. So again, tibial tuberosity comes straight across. You'll feel a bump right in the middle. We're going to make a mark right there. That is our fibular head. So we're right there, coming straight across from tibial tuberosity. So you can do this on yourself. You can feel free to mark yourself up. Obviously, if you have a quarantine bunny, feel free to do that also. But those are all the major landmarks of the tibia and the fibula.